This is a question from somebody who's been dealing with severe menopause symptoms for over a decade, and it's contributed to weight loss issues. And she has tried everything, so she's wondering what you would recommend for somebody who has done everything for weight loss and cannot seem to keep it off and deals with menopause symptoms still.
Okay, first of all, the reference ranges are incorrect. The testosterone reference range is too low, and a lot of doctors feel that if the women are between these reference ranges, they're okay. So for testosterone, the range has to be much higher, the optimal range much higher than what's listed as a reference range. So testosterone helps women lose weight. A lot of doctors don't understand the correct estradiol to estrone ratio. So you need to have 2 parts estradiol to 1 part estrone. And unfortunately, the creams can give you too much estrone, and that can make you gain weight. So the hormone pellets, the estradiol and testosterone pellets, work the best in losing weight. And then the women can get on a ketogenic diet, and we have a special ketogenic diet and a special fast that women can get on, and they all lose weight on the ketogenic diet and the special fast.
Now, what's the optimal range for testosterone for a woman in menopause? And can you give a range of testosterone levels that are healthy for women in their 30s, 40s, 50s, and 60s?
We'd like to get testosterone back to a 25-year-old level, and I usually use 70 to 130 as a cutoff or the optimal range. And most labs have a range of 5 to 70 as their range for testosterone, but my range is 70 to 130 with the creams. 5 weeks after pellets, you can have the upper range go up to 200 or even 300 sometimes temporarily. So that's what's the problem these days, is the ranges are too low. The upper ranges are too low.
Okay, so a good protocol for somebody who's been struggling with weight loss and menopause symptoms is to get their hormones reevaluated in a range that's effective instead of just a baseline norm, and then the ketogenic diet.
Yes, the ketogenic diet also, they have to check their temperatures in the afternoon, their oral temperatures, because there's a lot of people that are borderline low in thyroid or even low in thyroid and have normal blood tests. So this is called type 2 hypothyroidism. So the doctor has to look at signs and symptoms and temperatures, and the temperature should be 36.7 to 37 degrees or 98.2 to 98.6 Fahrenheit. If they're below that range, they're probably low in thyroid hormone. And natural thyroid works better for 90% of patients instead of synthetic thyroid.
And what's the natural thyroid supplement you recommend?
Desiccated pork thyroid. Usually it's Armour thyroid.